Okay, this one really interesting. A promising development in Alzheimer's research this morning. Scientists say that your sense of smell could signal your risk of developing the disease. Researchers over at Mass General Brigham developed a smell test, or what's being called the aroma brain test. You sniff, you memorize smells. The study found that smells often evoke memories. You know, have you ever walked by something that smelled of your childhood? It brings back a memory where you were at the time. That's kind of the idea here. Board-certified neurologist Dr. Tom Pitts is with us this morning. Dr. Pitts, it's always good to have you. Okay, an at-home smell test. Tell us more. How does this work?
Good morning, Markie. Well, looks like we have some very promising findings here. And the reason why this is important is we've always had the dilemma of finding non-invasive and early testing, meaning we have testing to diagnose Alzheimer's, but it's relatively cumbersome. PET scans are not easy to get. Lumbar punctures are invasive procedures with possible complications, and we're not going to do them preventatively. On the other hand, we've come up with things like blood tests, but they may not detect things as early as we need because most of our medicines are aimed at preventing decline. We don't really have many things to reverse damage, so we want to catch this early. This test has been extremely positive. Recipients get a 9-point test. They scratch it off like a lottery ticket or something. Yeah. They smell it. They identify the smell, so that's smell identification. That's checking one part of the brain that we can talk about. And then also they go back and do odor memory recall, where they go back and say, hey, what was that smell you smelled earlier? And what that's doing, it's not really about smell. We're hijacking the olfactory pathway, which has direct access to some of the first and most heavily hit areas of Alzheimer's, like the entorhinal cortex, responsible for navigation and memory input, the amygdala, responsible for some emotional limbic system related issues, and also the hippocampus, which is really has to do with memory consolidation.
Yeah. And you think about doing this test at home, I'm just wondering, could that potentially skew results? You got other smells going on, you got distractions around the house. I mean, pun intended, but does this pass your smell test? Do you like this idea of a test like this?
By and large, first of all, I have to commend you because you're looking for confounding variables, and that's something we're taught in school. It's not a concept we always think of. So absolutely right? You don't want to be in a very like while I'm cooking with olive oil, white wine, and garlic over here, I don't want to be also trying to smell cinnamon or something like that. It should be a relatively neutral, sterile environment. But if you eliminate confounding variables, it's very promising, and especially for early detection where people have minimal symptoms and we say, do we really want to do a lumbar puncture on somebody over these like relatively trivial, maybe just brain fog, some general complaints earlier age, or a PET scan, insurance likely won't improve it. And so we are very we are reactionary. We're looking at it when people get very bad, then we're able to get these tests. This, at least, despite maybe some shortcomings, as you mentioned, in its application at home with other odors, at least is promising that it can provide early detection and accuracy in the vast majority of people.
I was actually born without a sense of smell. I have congenital anosmia, so I'm just wondering, what does that mean for folks like me?
All right.
I mean, I'm just out of luck here, Dr. Pitts.
Well, first of all, congratulate you on being a warrior, because I know that can be a very difficult condition. I dealt with loss of smell and abnormal smell a lot, of course, as you know, during COVID. Where viruses, polio, make their way through the olfactory pathway into these vital areas. So I'm so sorry that happened. You may want to consider olfactory retraining, by the way.
I've never known anything different. So I don't feel like I actually, when I got COVID a couple times, I was like, I wonder if I'll have the opposite, where everyone else is losing their sense of smell and all of a sudden magically get mine. But it didn't happen that way. So,
wouldn't that be something? Well, yeah, you likely would not be able to take this test, though, Markie. I'm sorry to tell you that. However, there are other promising modalities. I think we've discussed blood tests and things like that on the horizon. This one is just the ultra easy version. There are less invasive than lumbar puncture versions that we've spoke about, namely blood tests and other imaging modalities as well.
Okay, well, fascinating. And I know this is on a lot of families' radars to try for themselves. Board-certified neurologist Dr. Tom Pitts, it's always good to have you. Thank you, my friend. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.